day of the procedure, you come in. It's okay to eat a light meal that day. You don't have to be NPO. And we'll talk, we'll meet your partner, have everything ready. You will have had instructions and what to expect afterwards. And so we come in and sit here in the chair and begin the process, which is an incision that goes basically underneath the temple or sideburn hair tuft. It curves along the borders of the ear, and then behind the ear where it meets the back of the neck, and then sometimes along the back of the hairline a little bit as well. And so right here in this chair, we'll make you comfortable, and we pick one side to begin first. The skin is prepped. Of course, we have all the necessary instruments available, and we begin the local anesthesia process, which takes about 5 minutes. It stings a little bit of burning here and there, a little bit of a pressure sensation, but it's not torture. So once the surgical zone is numbed, it's also vasoconstricted, so we won't have the bleeding that you would expect during the surgical process. And so what we'll do is we'll separate the skin from the underlying tissue. We're going to tighten the muscle and the underlying tissue called the SMAS, which is an acronym. It's SMAS. So it's basically a 2-layer facelift. It's not a skin-only facelift. And so when the underlying tissue is tightened, that transports the skin forward, and our extra skin is then marked for removal and basically excised. And the key point here is the skin is not excised under extreme tension. So the goal of this procedure is not to make your skin tight and your neck a right angle, tight neck for 10 years in the future. The goal is to make it better, very good, natural, and look completely blended in with your face and your body and not be extreme. Excessive tension is a big mistake, and it's always better to do what's going to look good and then do perhaps a touch-up or some other ancillary procedure, maybe a year later, 2-3 years later, but not go for that super tight look, which essentially nobody wants. So the procedure is performed on one side, repeated on the other side, and all in all, it takes about 2 hours. And the whole time you were either snoozing because you felt relaxed, you had a little bit of Valium, or more often you were actually awake and talking and conversing, and oftentimes literally enjoying the procedure. So that's the procedure in a nutshell. We can add other procedures to it as well. Sometimes we perform liposuction of the neck. We can use a laser called the Smart Lipo laser to help with the tightening of the central neck as well. Sometimes we'll add a upper eyelid lift or a lower eyelid lift, occasionally fat injection. But the goal here is to have a 2-hour, 3-hour max procedure. We're not trying to do every procedure under the sun in one setting here in the office.